Hi, I'm Dr. Keith Ryan, a chiropractor in Tulsa, Oklahoma. I wanted to talk to you about low back pain that radiates down your leg. Um, what happens when you have low back pain that's coming down your leg is you irritated the nerve roots in your lower back, and they transcend down a big nerve, generally called the sciatic nerve, that comes down the back part of your leg, out of generally, L3, L4, and L5, and S1 and S2. Those are the last three lumbar vertebrae. You have five lumbar vertebrae in your low back, and the upper part of your sacral segments, and the nerve roots join into that, form the sciatic nerve, and then it radiates down your leg. Now, how does that happen? Generally, by a couple of ways. One, you can have your vertebrae out of alignment that can irritate those nerve roots, and then it'll have radiating pain down the leg. You can also have your sacroiliac joints, which are not part of your lumbar spine, is more part of your pelvis, irritated, and that can irritate those nerve roots and come down your leg also across there. It's really important to note which one it is when you're being treated for, because there are particular circumstances when this happens that you go to your doctor and they do an MRI and they'll find a disc bulge, and then they'll immediately go, okay, well that's the deal. I mean, so you need surgery, let's take care of that. And that's not necessarily the case, because sometimes you can have the vertebrae out of alignment, or you can have the sacroiliac joints, and we work on those and we clear those up. You can also have the occasion that you have the disc bulge sitting there that looks pretty mean on the MRI, but it's not actually the problem. Or it can have the MRI that's the problem, and sometimes manipulation clears that up. I've only had a few patients that have had to have surgery over this, so I know that even with the really mean looking disc bulge, most people can get better without the surgery and be just fine from not having it. Now, you can also have leg pain in other areas. You can have leg pain coming down the front of your leg or the sides of your legs. That doesn't have to be related to the sciatic nerve. They can be other nerves, but generally they are caused by pelvic pain or lumbars out of alignment, and manipulation really makes a big difference in correcting those. So I guess my thoughts on this: if you're having lumbar pain that's radiating down your leg, as a first course of business, I would try to get it corrected by a chiropractor before you go to any big steps of surgery or that sort of thing, and you might want to get the MRI. Sometimes people feel better when they look at them, and I like to see MRIs too. You get to see where it's going, but I don't jump to conclusions when I see them, because I know the kind of results we get in correcting people with the pain down their leg. Hope this helps you a little bit, gives you a little advice on what to do. Thanks so much.